A pleasure to have you join us today on the program Healthy Living. I'm Adisu Sawake. Every Monday we do our best to bring you new topics as regards your health so that you can be well. When you are well, everything goes smoothly for you. You are happy. All right, but when you are unwell, no matter how minute you think that ailment may be, it disturbs a lot. But unfortunately, some of us don't even know how to go to the hospital, how to access health care, even if it is at our doorsteps. You know, we don't like to do it until it becomes an emergency. That ought not to be the case. Today we're going to look at cancer. Every 4th of February is that special day set aside to create more awareness on this issue of cancer. It could be anywhere. Cancer of the cervix, of the womb, you name it, of the blood, you name it. All right, so that day is set aside to create awareness. Why? For what purpose? Of course, everybody knows what cancer is. Everybody knows that it kills. Everybody knows that quite a number of persons die every year. About, so huge a number die every year. But why should we create more awareness? This question will be answered in a moment as I have two distinguished persons in the house who are going to be talking to us on this issue. Let me introduce the lady first. Ladies first, as we used to say. Let me quickly introduce to you Dr. Lucy Idiese. I hope I got that well.
Yes, thank you.
She is a consultant, radiation and clinical oncologist from the University of Benin Teaching Hospital. It's a pleasure to have you join us.
Thank you for having me.
It's been a while. I've missed you so much on the program. Thank you for finding time to be with us today.
Thank you for having me.
Okay, so I introduce the gentleman now. Is Dr. Evaristus Obo. He's also a consultant, radiation and clinical oncologist. Doctors, it's a pleasure to have you,
very much.
Our midst today. Every 4th of February is a day set aside to create more awareness on cancer. Please tell me more about this, particularly that of this year and the day. Dr. Lucy.
Thank you. Cancer, which we all know, is a disease where abnormal cells divide uncontrollably and tend to destroy normal tissues in the body. Every February 4th is set aside as a time where awareness is created to let the people know that cancer is not only real, but also cancer, if detected early, can have good cure. Okay. The team actually for this year, yes, good
if detected early.
Yes, early detection, they say saves lives. The team for this year is actually closing the care gap. That's cancer care gap. As we all know, there are inequalities, a lot of gaps everywhere.
And particularly in this setting.
In our setting, gaps in treatment, gaps in diagnosis, gaps in patients coming on time. The major problem we have here is late presentation. So we want to see how much we can do to close this care gap at all levels. The care gap at individual levels, at institutional levels, community levels, and of course, the general society at large. That's the same for this year.
So, but let's go by the team. Closing the equality gap in access to cancer prevention, diagnosis, treatment care, and a lot more. Now, Dr. Lucy say that early presentation of this disease can save life. But unfortunately, people even like cancer. So let's look at the issue of the cancer.
Thank you very much.
People know until stage 4 or
yes, that's
why
no
is
problem.
it like that?
Yes, thank you. We have generally people in this part of the world have this poor health behavior. That's the first fact. And secondly, it's been observed from studies showing that most of the patients who present to facilities for cancer treatment normally present at very advanced stages, either stage 3, stage 4, and oftentimes metastatic. And in fact, studies have shown that as much as 80% of patients who come to us for treatment come in that stage. So how do we, that's a very important aspect of closing the gap. How do you close that gap? One is to ensure these patients actually come around at an early stage when they can have treatment which is curative, radical treatment with aim of cure. That's it. So closing that gap, like Shirley mentioned, you close the gap from area of trying to create awareness, like we're doing right here in this studio. Creating awareness, educating the populace, and doing cancer advocacy. So that they will understand what the common symptoms of cancers are, what to do to even prevent having cancers. Then also, secondary part of prevention is actually called prevention. Screening in that aspect. What does that mean? We screen patients. You don't have to have symptoms before you start going for screening. Just make it part of your medicals.
You know, in this part of the world,
Yeah.
we wait until 9 minutes.
So yeah, so every year go for your medicals, do for screening, cervical screening, do pap smear for women, breast mammogram. Also at home you can do your self-examination, which men do on their own, PSA screening. Those should be done annually if possible. When those are done usually, you often get the cancers at early stage because then there are no symptoms. In fact, they are found incidentally. I don't have any symptoms, I have no complaint, I'm good, I'm fine. I've gone for yearly medicals and they found something there that's abnormal. Oh, maybe trying to change to something else, you know. At that stage, oftentimes it's very early stage. Or even the one we call carcinoma in situ, trying to progress to cancer. At that stage, what they can have is what we call radical treatment with aim of cure. So like you rightly said, you can actually have cure and patient lives his or her life normally. But like we have here, they come to time in stage 4, stage 3, when the cancer advanced so much. And the best we can offer, even the best of centers, is what we call palliative care. The aim of that is what? To just try and improve quality of life and see how much you can prolong the patient's life. It's sad that that's how most patients come to us, and that we're having this awareness program to show that people know what to do, look for screening regularly, then also live healthily in terms of lifestyle modification.
Okay, Dr. Obo, thank you. Let me talk to you now, my sister, my friend, Dr. Lucy. Despite awareness in cancer prevention, the diagnosis, treatment, millions of people around the world still face serious barriers, you know, to access to medical care, particularly the indigent in the society, and even those who are enlightened, even those who are educated, they still fall into this category of not going to the hospital, like doctor said. They wait until there is absolutely nothing to be done before they present. We have been making awareness campaign year in, year out. Is there any other thing that can be done so that people will know what to do, what the preventive measures they can take, whether at home or they go to the hospital? No, like lifestyle, anything.
Okay, thank you very much. In fact, when you're talking about cancer care, look at it from this angle. Prevent the preventables.
Okay.
Cure the curables. Treat the treatables.
Okay.
Then palliate the palliatables.
Oh, that's fantastic.
Yeah, so a lot can be done. And it starts from screening. That is why we are talking about awareness. People need to know that before the cancer announces itself, you should actually go for a checkup.
Okay.
Screening is done when you are well. Symptoms have not yet shown.
So,
If a patient or a client is caught at that level, at that precancerous level, and treated, the person will be 100% cured.
you don't have to wait for symptoms.
You don't have to wait for symptoms. So the advocacy here is that everybody should avail themselves to screening facilities. Like last week was we had a lot of screening being done. The Medical Women Association of Nigeria,
because when
where
it
I
comes
belong,
to,
yes.
When it comes to such medical services, people ask that question: is it free? Is it no money I'm going to pay there? Do I have that kind of money? People usually don't have money for healthcare services, but for other things, somehow
yes.
money
comes.
Know what's happening, and then we face a lot of things. It's not my portion and all of that. Please disabuse our minds. We're not saying people should not have faith, but then we're talking about health here.
The truth about it is that we should all know that health is wealth. It's somebody that is alive that will wear that clothes that you're going to buy for so many thousands. Okay. It's somebody that is alive that will eat that food that you think is so expensive. It's somebody that is alive that will drive that very expensive cars. So we should all adopt a policy whereby we set aside a particular amount every month, every year for our routine screening. There are some NGOs that usually have free screening. That during this cancer week last week, the Medical Women Association of Nigeria had free screening at the doctor's house for a whole week. The radiotherapy department, radiation and clinical oncology department, where we belong to, also had program for the whole of last week. But people are not availing themselves. So it's not all about money. I think there's also ignorance. Okay. People do not know. Then this issue of faith is also very important.
Ignorance and carelessness.
Carelessness, ignorance, they're faithing things. Somebody will tell you that when I go to the hospital, they must see something. A diagnosis must be made. So people run away, not knowing that actually prevention is far cheaper than cure. Because cancer care right now is really very expensive. But prevention, screening is far cheaper than when the diagnosis is made. So we advocate that everybody should go for screening. Women should go for their breast examination. You do your breast self-examination on your own monthly, then you do the clinical breast examination. Sometimes the health personnel will be able to find some other things that you are not finding out. If you are 40 years and above, you go for a mammography. If you are less than 40, you go for a breast ultrasound. Same also with cervical screening. The truth about it is that when you go for cervical screening, it's actually found out that when you have precancerous lesion, it takes between 15 to 20 years before it becomes full-blown cancer.
Wow.
So you have a lot of time where you can actually go for good treatment. And once a disease is found at that level, at the precancerous lesion stage, so treatment is done, efficacious treatment, and the person is 100% cured. So we are advocating to everyone that we should go avail ourselves for screening. Okay, sometimes it might not be free, but you pay, and it's not much. There are centers in different hospitals where they have screening facilities. We should avail ourselves, go for screening. Just go in and tell them, I want to come for medical screening. I heard that we should be checking ourselves, and you go for such screening. So the issue now is that everyone should go for screening. Go for screening, go for screening, go for screening. Thank you.
Okay, Dr. Obo, is it true that we have a high prevalence of cancer in our society today than what we used to have like 10 years ago?
Yes, it's true.
True. So what could be responsible for this trend? Is it food? Is it drink? Is it cosmetics? Because we have quite a number of things in the market today.
Yes, there had been increasing cancer prevalence. In fact, we have studies that were done as far back in the 2020 that showed that we had as much as 100,000 new cases, annually. That moved to as much as about 200,000 in 2015. So that tells you that there has been increase in prevalence of cancer cases. So one of the reasons we attribute it to one are there are very many factors. We have things like us adopting Western life in terms of
enjoyment,
even a diet.
Okay.
Most of the time, people now tend to take more things like maybe what we call this red meat.
Okay.
Red meat, which we all know what they are. They've found to be a strong risk factor for colon cancers.
Red meat.
Yeah, red meat, yes. So other things we also have, and in fact, things like maybe aflatoxins we see in some of these nuts, understand? They have this, that be found to be present in liver cancers as well. Others are also the fact that we were not actually screening in those days as we are doing now.
Wow.
So with more screening we are doing, people now tend to actually discover that they have cancers, because the more you screen, the more you see cases of cancer, make cancer diagnosis. Then also, even of smoking. We can share it with lung cancers, bladder cancers. Smoking is a strong risk factor for bladder cancers and lung cancers. Others are even alcohol intake. People tend to also take alcohol now more than they used to do in those days. Association. So also most oral tumors we have, like oral cavity tumors we have, alcohol has been found to be one of the major etiological agents. So because of that, I will tell you that we have more cases now. The burden is higher, and incidentally, we are not prepared for it. Because I will tell you that Africa actually accounts for less than 15% of world cancer incidents, but we account for over 70% of cancer deaths. That tells you that we have 70%. Cancers, but compared to the whole world, it's not so big. But more people are dying in Africa than are dying outside. Why? Because they're coming at very advanced stages, and we're also having what we call the high-grade tumors, the one that are point-related tumors that are a bit more aggressive and don't respond more to treatment like others do. Then also, the late presentation. Like I mentioned, over 80% present to us with stage 4, stage 3 cancers. So if you screen, like my colleague mentioned, you screen, you like to get this cancer at an early stage. We also mentioned precancerous state, where you have the cancer change to cancer in the next 15, 20 years. But within 2-3 weeks, you can correct that, and that is averted from that progression. So the best thing is, like you said, screen. But we have problems with that right now. There are certain facilities, but we need more of that. We need more of
So
it
the
because
facilities are not enough.
they are there, but we need more of it. We need more of it because you have to look at the rural areas. They live so far from the urban areas, and then coming to screen and time can be a problem for them. So this can be sited in those rural areas so that they can have screening. They can have screening done there, and also we can have the cost also subsidized for them. Because they're really discouraged. Like you mentioned, it's expensive.
Who is going to do the subsidy for
It's the government. It's the government. The government, and also that cancer treatment should also be made, create more centers for treating cancer. How?
How much is usually allocated to health when it comes to the budget as a whole? Is it enough?
I don't have the figure, but I know that we are not doing enough because per capita is about $105 in Nigeria. Well, abroad, it's about 5,000 per capita. So that is we're talking $105 to $5,000. That's a lot.
That's a huge
so now
difference.
looking at the issue of the treatment, now somebody now has done screening, now he has going to have cancer. How will he get treatment? That's a problem we're having. According to the World Organization, Nigeria should have over 350 machines working for cancer treatment. But right now, we don't have up to 5 working in the whole country.
Please go over that again.
I said, according to the World Organization
yes.
and IAEA, we should have over 350 machines working in this country based on our population, over 200 million. But we don't have up to 5 working in the country right now.
It's supposed to be like one machine for 100 million people.
One machine for 100,
yes.
But it's not like that.
Oh no, we have less than yes, we have less than 5.
We have less than 5 working.
Currently working.
Yeah. So it shows that the treatment centers are not even enough. Like patients go through a lot to get treatment. In fact, I use the word migration. Moving the whole country, people moving to Lagos, going to Abuja to get treatment. That should not be the case. So what we say now is that if we even go by the World Organization, that let's have one machine for 350,000 people, that is even fair enough. Even to 1 million is also fair enough. But I'm talking about 4 machines serving over 200 million people. That's like a machine to 50 million people.
That's sad.
So that shows that
sad.
People cannot access radiotherapy treatment. In fact, our patients go through a lot to get treatment. In fact, some are sent to Lagos, I can't go to Lagos, I can go to Sokoto. So it's very frustrating. So government has to provide more screening centers, they have to provide more cancer training centers, treatment centers, and also training for cancer health professionals who will do the treatment of this patient. So there are very many gaps we're talking about, the gaps of diagnosis, gaps of screening, gaps of awareness, advocacy, cancer education gaps, and treatment gaps. That's why I think of this year is filling the care gap of patients. So what we are here to talk about that those gaps have to be filled for our patients to actually have what is designed to cancer treatment and having excellent outcome.
Thank you, Dr. Obo. Dr. Lucy, do you think we have to wait till February 4th before we can do all of these activities? Because judging from what both of you have said, we need aggressive advocacy. We need aggressive education. We need aggressive approach to enlightening people. Because even as we speak, people are doing worse things now as regards tobacco, alcohol, and all of that, bleaching cream, you name it, and nobody is listening. The other day I was on radio and somebody said his grandfather has been smoking for over 99 years.
Wow.
And the grandfather is still alive.
So,
you know, so he does
he
not
has the
think
permission
that,
to go ahead and nothing will happen.
Exactly. So what else should we do? Because it's like every other thing we've been doing is not working. Because people are still presenting late. Like a couple of persons that I know have gone through some form of surgery or the other. It was just not because they wanted to go check for cancer. It was different that took them to the hospital, but only for doctors to discover that, oh, something abnormal is going on. So what else can we do apart from what we are doing now? Should we go door to door now?
No, we don't really have to. No, we don't really have to go door to door. All we need to do is to talk about this education at different levels. The churches, talk to your congregation members. Institutions, talk to your members. You know, the community, we have community heads where they have community meetings. Talk to your members. Then at large, this one we are doing also, coming on air to educate everyone. We let them know that this is what is happening and this is what everyone should do. Like we are rightly saying now, Many times, people are diagnosed and they seek alternative care. That's another very big gap that we have.
That's another problem.
Yes, alternative care. And we have to educate the people that if somebody comes and has a problem, please direct them to the hospital. You are not a doctor, for crying out loud. That you begin to make certain prescriptions, certain scarifications, and all sorts of concussions. We have seen where people tell them, don't go to the hospital. When you go, they will give you drugs and you will die. Okay, fine. If you go, you will die. If you don't go, you will die. Let's just assume that that is it. But we also know that when you go and you get treatment, because researches are being done, there are a lot of works are being done, so they're actually having cure. I can tell you that there are a lot of improvements in cancer care right now. We have high molecular targeted therapy that is very accurate and precise. We have a lot of research going on worldwide. This World Cancer Day has never been as explosive as it is this year. All centers, I can tell you, Osun State, Lagos State, everybody came out this time to advocate. So I think a lot is being done on our side. What we need to now do is to educate the people out there who are also leaders that please let your people be educated. Let them know that they should seek good health behaviors.
Without politicizing it.
Without politicizing it.
Because
we're talking about health.
Politics now.
Imagine now a patient comes and is diagnosed. He's going to look for a center to go for treatment. Many times they die on the road.
That's a problem.
It's so sad. So let us tell people that instead of waiting, once you detect anything wrong with your body, please go for immediate treatment. Some people find lumps in their body. They even go to some funny places. They remove those lumps, and histology is not done. Before you know what's happening, it reoccurs. Before you know what's happening, by the time they're coming to you, they are coming in stage 4 with metastasis all over. These are the things that are actually killing people. So education is so important. My dear sister, I can tell you.
Why is it that a lot of persons don't have confidence in the medical system?
I will not say they don't have confidence.
I was discussing with somebody last week here, and the person said, I beg. I mentioned the name of a medical center in this country. I beg. I don't want to go there.
They die there.
People will just be dying there. I beg. Let me just go to alternative.
The reason why they die there, according to them, is this. You have waited. You have gone to other places. It's now when the case is now beyond. Because by the time we get to stage 4, we say what kills people in cancer? Cancer is not the diagnosis that kills people. Cancer is not the treatment attitude that kills people. What kills people more in cancer care is late presentation, metastasis. By the time it's stage 4, there's nothing anybody actually can really do much anymore. So that time you waste, and we know that this disease is not waiting for anybody. Yes. So as the diagnosis is made, you should actually go for treatment almost immediately. But they go for other health alternatives, they go to other places, and by the time they get to the hospital level, they'll say it's late and they don't have confidence. They do, but just that ignorance, sometimes poverty. They say there's no money. It's not really poverty as it were in totality. It's the fact that priorities are missed.
Of course.
Instead of spending money on medications, somebody will go to a pharmacy, they prescribe a drug, he sees a brand that is 1,000 naira. This is an hour for 100. You tell them that 100 naira one.
After all, it's the same work.
Exactly. So there are a lot of issues.
Doctors, our time is fast spent. What's the way forward? In a minute, let me hear from you, Dr. Oku. What's the way forward on this issue?
Okay, thank you. The way forward, like we are here, that's part of the way forward. We need to keep engaging people. We have to create awareness. We have to do a lot of cancer advocacy. We have to actually educate the populace to know what the common symptoms of cancers are. That's one. And what they should also do, like we are doing now, to, like I mentioned, some of these habits, smoking, alcohol consumption, sedentary life, obesity, and all that.
Just live well.
Yeah, live well.
Healthy living.
All right, Doctor.
Very important.
The government to provide more centers for screening, funding for cancer care. You should do more, provide more treatment centers, screening centers, so I get cancer at an early stage when they can be given curative treatment.
Okay, I wish we could go on and on, but unfortunately we have to do the news at 3. Thank you, doctors, for finding time to be with us. Your health, people, is in your hands. Okay, if you present early, you'll be well. If you do medical check, you don't wait until you fall sick. Just go to the hospital, do some check when you're well, and everything will be normal. We'll see you again on Monday. Bye-bye.